Today we are on the Voluson Expert 22, and one of my favorite tools to use is OmniView. The exam that I use OmniView the most are fetal spines, the cavum septum pellucidum, the CSP, and I use that to evaluate the corpus callosum, and I also use it in my GYN scanning. Let me show you how to use it. In OmniView, we have the option for a line, a curve, a polyline, or a trace. When evaluating the fetal spine, I like to use polyline. The polyline allows you to drop multiple set points to follow multiple curvatures, just like we have in the fetal spine. So here you can see I am using my trackball and I am setting multiple points along the fetal spine. As you can see, the polyline is allowing me to set all these points along the gentle curves of the spine. I have added volume contrast imaging to my OmniView. This adds contrast to the image and also slice thickness. That can help you view structures that are out of plane. Once you set your endpoint, you can always adjust your line thickness to optimize your image. You can also rotate your OmniView line, and you can rotate your image using your X, Y, and Z axes. All of the adjustments you make in OmniView can enhance the quality of your image. Moving to a single image, you can see how well OmniView can highlight the bony structures of the fetal spine. This is my favorite way to evaluate the entire spine in the coronal plane. A feature of the Expert 22 is that you can trace using your finger on the touchscreen. Here I am selecting the Trace with X Touch, and you can see our spine image here. Using our finger, just trace the fetal spine just like we would with our trackball. This can give us a little bit better control of where we place that OmniView line. We still have the ability to adjust our VCI thickness. We can rotate our OmniView line. You have the option to magnify the image for better visualization. Incorporating OmniView into your obstetrical examination is an effective and optimal method for assessing the coronal plane of the fetal spine. To assess the corpus callosum, we must initially acquire the transthalamic axial plane of the fetal brain, which includes the cavum septum pellucidum. You will want to use the straight line in OmniView. Select Line from your line type menu. Using your trackball and set key, you will draw a straight line through the CSP along the midline falx. Here you can see the corpus callosum come into view. Here is when we take the time to optimize our image. We can rotate the image to be anatomically correct. We can adjust our image using our X, Y, and Z axes. We can increase or decrease our gain to better optimize that corpus callosum. We can always adjust the OmniView line, and we can adjust the slice thickness depending on our area of interest. And here you can see the corpus callosum. This is a great tool for you to use when you are evaluating the cavum septum pellucidum and the corpus callosum. The coronal plane of the uterus usually cannot be visualized by using our traditional 2D imaging. Therefore, adding volume rendering to your exams provides so much more diagnostic information. So let's learn how to evaluate the uterus using OmniView on the Voluson Expert 22. We've acquired this uterus in a sagittal plane. Here is the cervix. This is the myometrium or muscle of the uterus. This is the endometrium, and this is the subserosal or outer layer of the uterus. So now that we have saved this image, we want to learn how to evaluate the uterus and endometrium using OmniView. We want to select OmniView from our touch panel. Here we can choose what type of OmniView line we would like to use to evaluate the uterus and endometrium. These options include line, curve, trace, or polyline. The line types I use most often are curve, trace, and polyline. To use the curve line, draw a line using the trackball and set keys to place the beginning and the end points. Once the second placement is set, the curve now becomes active on the trackball to match the curvature of the anatomy you're evaluating. Using the trace line allows you to freehand trace with the trackball. Here I'm moving from the cervix through the endometrium and up through the fundus of the uterus. Polyline is an easy way to allow you to drop multiple set points to follow multiple curvatures, which is helpful with a flexed uterus. So here I am using my trackball and I'm working my way from the cervix, setting those multiple set points as I move straight up through the endometrial canal and out towards the fundus of the uterus. Polyline is the most helpful when you have an antiflexed uterus or if you have a retroflexed uterus, as you can set multiple points along the endometrium. Again, on the Expert 22, we have the option to trace with touch. So as we select this on our touch panel, we see our sagittal view of the uterus. Using your finger, I'm going to trace that endometrium along the touch panel. And there's our completed endometrium. Once set, we can adjust the position of our line. And we can also rotate our line as need be. Now that we have the single view of our coronal plane, we can adjust this endometrium by adjusting our X, our Y, and our Z axes. So let's start to optimize this image. We're going to rotate the uterus upright. Adding VCI or even tip mapping is helpful. Here you can see I'm adjusting the contrast of this image to enhance the visibility of the endometrium. So here I am fine-tuning the X, Y, and Z axes to bring that endometrium into our complete field of view. You can see how this demonstrates a beautiful endometrial canal coming from the cervix up through the fundal portion of the endometrium. So how does OmniView assist us when we suspect a uterine anomaly? In this example, we have a uterus in a sagittal plane. So here you can see from the cervix, and there's a weird shape to the endometrium. When we evaluate the uterus in the transverse plane and move towards the fundal portion of the uterus, you can clearly see that there is a break or split here, which tells us there is some type of uterine anomaly. To evaluate how deep that septum is of this uterine anomaly, we need to evaluate this uterus in a coronal plane. I'm going to use Polyline to evaluate this endometrium. So using our trackball, I'm going to set multiple points along the endometrium. I'm moving through the cervix, beginning to go into this endometrium. I can follow that little jump in the endometrium and use that to trace out to the fundus of the uterus. Adjusting the slice thickness is helpful with visualization depending on the anatomy being examined. Moving to a single view image, we're going to use our lollipop to stand the uterus upright and adjust using our X, Y, and Z axes. This view will lead to an accurate diagnosis of the uterine anomaly for the patient.